Hello everyone, this is Felix Konomakis, psychologist. Today I'd like to talk about the therapeutic treatment without considering the role of the client in it. I still see this outdated discussion forums where people say, all these therapists saying they can help somebody with one session, that's rubbish. You can't. Impossible, you need 3 sessions. And someone else said, no, you need 4 sessions. Well, what you're doing is you're replacing one golden rule with another golden rule, as if that makes any more sense. There is no golden rule. It depends on the client. To be honest, I've seen spectacular success with just 1 session. The client never needed more. Sometimes with the same approach, the client needs 3 sessions. Sometimes you give 3 sessions and there's still no change. The therapy is the same. It depends on the client. These are the variables. We've got to get away from this linear dichotomous thinking that it's the therapy itself that does this. If you're a tennis coach, you're going to use the same approach teaching people to play tennis with a broad spectrum of people. Some of your pupils may become professional tennis players and some won't. They don't all start off equally. Even very bad therapists will have that spectacular success story if the client is a really good client. The point is, can they get consistent results across the board with a range of clients? That's a better indicator of their therapeutic approach, and not 1 or 2 star stories. So the therapy has got to be good to start with. It's got to be better than other methods out there, but it's still constrained by the starting material, which is the client. It's a bit like going to the gym. Everyone who's going to attend the gym and is willing and able to follow instructions will get better results or progress as opposed to sitting on their ass back home. Some will be gym stars, will completely transform their bodies. Others will need more coaching. Some will do the opposite exercise of what you've told them to do and not develop the muscles they want. But on the whole, the program is good. It's faster, more effective relative to other gym programs. So again, it does depend on the client and the therapeutic approach. If you have a good therapeutic approach and a good client, it's a marriage made in heaven. Really good results, 1 session. If you have a good therapy with a mediocre client, results good, but a bit diluted. Obviously, if you have bad therapy and a great client, you'll usually have limited results without spectacular exception. A bad therapy, bad client, well, everybody bad all round. So, people will still say, does this therapy work? It didn't work. What is the it that didn't work? They're putting it all in the therapy and not realizing there's a role that the client has to play as well. So it does depend on the starting material too. Good therapies will act as a force amplifier. That is, even if the clients are not great clients, they can still get pretty great results. And then obviously bad therapies, if you have great clients, get some results, but not as good as they could have been. So it does really depend on the client too. If you have any questions, let me know, but hopefully this has been useful.